Assalamu alaikum. I'm Munir Sheikh, Vice Chairman of the Islamic Shura Council of Southern California. May Allah bless you and your families as we continue to grapple with the circumstances of COVID. Inshallah, things will change soon. I wanted to express my appreciation for all of your support to the Shura Council, and we want to invite you to our upcoming virtual banquet on April 3rd. We have a great lineup of speakers. Sheikh Suhaib Webb and Sheikh Muslima Permal will be joining us and sharing their thoughts on where we're going to go from here, inshallah. Really look forward to seeing you again April 3rd, 7:30 p.m. We have a great lineup for you and a lot of fun activities as well. See you there. Assalamu alaikum.
Greetings of peace. Welcome to our health program here on ShuraTV. Today is Tuesday, March 9th, 2021. We hope you've had a great week and hope you and your colleagues and your family and your loved ones are staying safe and healthy. And we wanted to just get back on track covering our different topics. Today, our topic is going to be arthritis and joint pain. But before that, we wanted to just get into the announcement yesterday from the CDC that they announced that there's more freedoms for people who have been vaccinated. They announced that vaccinated people from different families can get together indoors in small settings without masks, which is a great step getting back to normalization. So as long as they're vaccinated. The CDC gave new guidelines yesterday, which was Monday, February 8th, that you can have small gatherings of vaccinated people. And vaccinated means that you've had the vaccine at least 2 weeks ago, the Moderna and the Pfizer, the second dose 2 weeks ago. And if it's the Johnson & Johnson, the one dose, and it's been 2 weeks since the last dose you'd had. So that defines you as vaccinated. And, that's good progress, and I think now we have close to 40 million people in the U.S. that have been vaccinated, and the numbers are increasing. This last Saturday, they had a record 2.9 million people that were vaccinated on one day. So the numbers are getting better, and I encourage you to try to get vaccinated. The tiers have changed. Find out from your local counties and cities where you can get vaccinated. There's a lot of online web resources that you can look at and schedule yourself. And I think now even teachers and people working at health facilities and some non-essential people are getting vaccinated as well as if you're a senior or if you have a underlying medical condition, you have blood pressure, asthma, anything in addition to that can increase your risk. You can get vaccinated now. So that's great news. So getting to our topic today, we wanted to discuss arthritis. A lot of people have pain and a lot of joint pain. It's the number one cause of, ER visits. It's a lot of, back pain, joint pain, knee pain. People get injured or people have chronic conditions. And when we talk about arthritis, there's two types, right? There's the major categories are, osteoarthritis, which is OA on our diagram. And then there's rheumatoid arthritis, which is a autoimmune disease. Now, they both have, the pain, the stiffness, the weakness, and the lack of mobility. And that lack of mobility can sometimes lead to depression as well. So it affects, the whole mobility of a person and your whole life activities. But you have to be able to know exactly what you have in order for you to get the best treatment possible. So we're going to go through these two little diagrams, which highlight the differences. Osteoarthritis is something where it's the inflammation of the joint specifically, and it could be any joint, but usually it's not symmetrical. If someone says, hey, I have shoulder pain on both shoulders or both elbows or both knees, and there's a symmetry, that indicates to us that, that might be from a rheumatoid origin, meaning some type of autoimmune response. And that's different from the osteoarthritis, where you get it from overuse and wear and tear, where most people that are, age-related changes, they call it. As you get older, you do get certain degenerative changes in different joints, whether it's your spine or neck or lower back or knee or elbows or shoulders. It's just from wear and tear. That gives you the osteoarthritis. So the osteoarthritis, again, it's asymmetrical, meaning that it doesn't involve equal joint. It might be one joint that's really bothering you. Usually the joint isn't warm to touch, and usually you'll hear some noises, the crackling noises. When you hear that, that's osteoarthritis. And of course, over time, slowly it gets worse. That's this line that's going up. It says slow, but over time, the severity of osteoarthritis gets worse if you don't get treatment or if you don't pay attention to it, as opposed to rheumatoid arthritis. Rheumatoid arthritis, obviously, it's an autoimmune, meaning that you have all these little antibodies that are forming in the body, and usually they form in the morning. There's more. So you have symmetry. You'll have multiple joints that are equally affected, and then it'll be warm to touch. That the joints are usually because they have the antibodies, and then also it has a morning. When you first get up in the morning, you'll feel it more than during the day. And then the other thing is that with rheumatoid arthritis, it can be accompanied with fever, tiredness, and other vasculitis, meaning other diseases. And to get into osteoarthritis a little bit more, as we stated before, osteoarthritis is the most common type of joint disease, osteoarthritis. And, they say it's biomechanical, meaning that it's not from inflammation, but it's from overuse and possible injury. So it affects the weight-bearing joints, meaning your hips, your knees, and it's more likely to affect the lower extremities, meaning that there's pressure on them, there's constant pressure on them, so they start getting bone changes in those arthritic joints. So usually with osteoarthritis, the bone itself gets bigger and the cartilage decreases, but they get bone deformities. Obesity is definitely a risk factor. If you have a heavier load on your joints, you can get osteoarthritis more often than not. You have a higher chance of getting such a thing. And then also, if you have a job that requires heavy labor, you're lifting boxes. If you work for UPS, Amazon, these kind of things, and you're lifting and pushing boxes in the warehouse, or if you have something where it has physical labor, you're more prone to osteoarthritis. And then, of course, injury and trauma. People get injured on, whether they're playing sports, you can get this type of injury, and if it's repetitive, then it can lead to inflammation of that joint. And also, the other issue is if on the morning stiffness we discussed already, right? It lasts less than 30 minutes. And then the joint fluid analysis, usually the white blood count is greater than 200 or less than 2,000. So, and the type of cells that they see would be lymphocytes and not the neutrophils. Neutrophils are usually with the rheumatoid arthritis response, where they have a flare up and they get a high inflammation real quickly. And then also you don't get synovitis, which is the fluid around the joint. You don't get an inflammation or an infection of that, which is seen in rheumatoid arthritis as opposed to osteoarthritis. Also, in terms of mechanical weight bearing, so we said obesity is a factor. So 1 pound of fat in the body affects those lower joints by 5 pounds of pressure. So if someone is coming in and they're overweight and they have knee problems or hip problems or ankle problems, we recommend for them to lose at least 10 pounds. If they lose 10 pounds, they would take off 50 pounds of pressure from the knees and from the hip. So that's very significant for osteoarthritis. And this is the most common type of joint disease that you see. Typically, if you're going to your doctor for this problem, you have a knee, you have a shoulder, you have a hip. Initially, what will happen is, your primary care doctor might give you some non-steroidal anti-inflammatories, maybe ibuprofen, to just take care of the pain and kind of calm it down. But eventually, they'll refer you to an orthopedic surgeon. You go to your orthopod, and they'll do the imaging for you, and they'll look at the joint clearly to see what type of mechanical obstruction there is, what has happened in terms of the physical damage. Once that's determined, they typically will tell you to go and get physical therapy. And if physical therapy does well for you 4 to 6 weeks, 2 to 3 times a week, if it does well for you and relieves your pain and gets you moving, great. If not, they'll recommend cortisone injections typically for the joint to decrease the pain. And they'll usually go through 3 sets of cortisone injections if that's warranted. And, each orthopedic surgeon has their own protocol that they follow, but this is just a general idea of what they'll do. And then if the cortisone doesn't help, then they'll recommend the surgery. So that's sort of the surgical path to osteoarthritis. And the goal for us is always to kind of prevent our joints from getting to that point. And we'll discuss later on, what to do and what not to do to kind of preserve joint health. In terms of rheumatoid arthritis, right? We mentioned again, just to review, it's autoimmune, meaning that your body's attacking itself, its own joints. It's a chronic condition. You'll find these people that they've had this issue for multiple years, and it is systemic, right? So meaning that there's inflammation throughout the body. So what will you see? You'll see the signs of inflammation, the redness, the swollen, the heat, the pain. You'll see all that pain and swelling, right? You'll see that. And then, of course, you see the systemic manifestations of, fever, weight loss, night sweats, etc. And then as the day progresses, it gets better, and it's worse in the morning. It's much worse in the morning because you have a lot of these antibodies that are produced while you're sleeping, and by the time you get up, once you start moving, then the pain decreases. And of course, it's symmetric. So if it's not just one joint, it's usually multiple joints, and it's on both sides of the body. The auto antibodies don't discriminate. They attack all the joints. And then you have an elevation of ESR, which is erythrocyte sedimentation rate. This is a lab value, and CRP, C-reactive protein, which they see through your lab tests, and those will both be high. ESR and CRP. So if you're someone that chronically, when you get your blood tests every 3 months, because you might be on some medication and you see that your CRP is always high, there might be some type of autoimmune issue going on in your body. So you need to have that kind of fleshed out and investigated by your doctor so that you know what's going on with that. That's rheumatoid arthritis. Rheumatoid arthritis now, it's fairly common, but it's more common, 4 times more common in women than men. So this autoimmune issue, this type of arthritis, this type of joint disease is more common in women. And also another form of it would be psoriatic, meaning you get those scales on your skins. You get that the scaly skin with psoriasis, and then you also get the joint disease together. So that's another form of it. Another issue would be the uric acid gathering. in joints with gout. That's also, these are all in the same family. So people get these issues, and you know, the doctor has to kind of decipher what it is and how to go about in terms of treating it. It's important. Things that you can do. Also with rheumatoid arthritis, people describe a very warm, hot feeling in the joint sometimes. So that's another telltale sign of it. And typically, you know, it doesn't discriminate on which joint. You'll get different joints with different manifestations. So that's the case on that one. Now, in order for us to prevent ourselves from getting these types of issues, there's obviously what you put in your mouth, what you eat affects it, right? So foods to eat, you know, we have this graphic here for you guys. Leafy greens, these are very anti-inflammatory. Cruciferous vegetables, salmon, avocado, sweet potatoes, squash, berries, bone broth. These things are anti-inflammatory, so these are good. Things to avoid, you know, processed and refined foods, sugars, high carbs, beans and legumes, artificial sweeteners, alcohol, caffeine, preservatives, gluten and grains. These things you avoid. There's a lot out there on what to do and what not to do in terms of arthritic joints. Obviously, if you have the biomechanical osteoarthritis on that one joint, you take care of that, you take the x-rays, you see what's out there. Obviously, we want to avoid surgery unless it's absolutely necessary. And if it comes to the point where you're recommended to get surgery, always get a second opinion. It's always a good idea. You know, two heads are better than one. It's better to get a second opinion and make sure that it's the right thing you're doing. There's also a lot of different, what they call biologic treatments now for osteoarthritis in the joints, where they inject cellular therapies into the joints. And with PRP, platelet-rich plasma, they inject that into the joints. It does just as good as cortisone would, if not better. There's many studies that are coming out that are showing that PRP is doing better than cortisone in terms of joints. Currently, all these athletes that we see in the NFL, NBA, these people all get regular PRP injections in their joints that are bothering them. So that's something which is up and coming, and that paradigm of, you know, injecting cortisone into the joints is slowly going to be changing once the general studies get approved and peer reviewed and published. So that's happening now. But you know, the athletes and people that have access to these treatments are getting them currently. And then also there's the cell therapy that they're getting for joint disease. Cell therapy helps with decreasing the inflammation and balancing the bone making and the bone destroying cells in the joint. So this helps as well, where it sort of balances out the normal milieu of what's going on in that joint. So the normal cells that are there that might be deficient, the cell therapy balances that out. And that's available now here in the US. Before, people used to go to Germany and Switzerland and Brazil and Costa Rica, etc., to get cell therapy, but now it's available in the US and people get it. And there are clinics that do that for the knee pain, for the joint pain, for the back, cervical, neck, elbow, tennis elbow, for all these common osteoarthritic conditions. That's available, and it's always important to inform yourself of all your options. And we try to do that as well for you here. We try to, you know, gather the latest information for you and the treatment so that you make a informed decision about your treatment moving forward. For the rheumatoid arthritis, there's also the cell therapies as well as the biological medications that your doctor will put you on. And those biological medications that they put you on, some people might have certain reactions and side effects, and then they change you to another one to make sure that it matches your your body, so you're not reacting to it. But there's things out there like Humira and other biologics that people utilize now for rheumatoid arthritis, because it is a chronic condition, and there is no known cure for the autoimmune rheumatoid arthritis. So they give you the symptomatic treatment with those medications, and people do well on them, and they enjoy their life. They also get cell therapy for it. There's protocols that they follow, and there's up and coming research that will show that different effects of cell therapy for rheumatoid conditions, autoimmune conditions. So those things are out there. The future in terms of the biologics is looking good. There's many new innovations coming into the realm for these pathologies, and you should always look out for them and ask your doctor, what's the latest and greatest thing, so that you make sure that you don't jump into a surgery unnecessarily. But if you have to do surgery and there's a mechanical issue, then make sure you have a better surgeon and do well, and talk to them, and let them know how you're doing and what your feeling is, and then get your second opinion and go with it. But just gather all the info you can, and we encourage you to do that. That's important. You need to be an advocate for your health, as in anywhere else. It's very important to have that advocacy and get that information and knowledge before you make any major decisions in terms of major surgeries or orthopedic surgeries that you might be getting. And if you need help with that, you can always reach out to us in the comment section, and we can always put you in touch with good surgeons that can take care of you. With that, I think we'll wrap it up. That's it for osteoarthritis for today. You guys have a nice week, and we'll see you next week. Stay safe and take care.